Lemons have long been considered a symbol of health and cleansing. People add them to water, tea, salads, and even weight loss remedies. However, behind this citrus cult lies some concerning facts that are rarely talked about. In this video, you will learn what might be wrong with lemons and why consuming them every day can lead to serious health problems, especially if you do not know when to stop. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Increased risk of kidney stones from excessive vitamin C intake. According to the National Institute of Diabetes and Digestive and Kidney Diseases, in the United States, the number of patients with kidney stones has increased by 40% over the past 10 years. What is especially concerning is the growing number of cases among people between the ages of 40 and 60, many of whom actively monitor their health and consume trendy natural supplements and detox products. One of the most popular ingredients in these routines is lemon. Rich in vitamin C, lemons have become a staple in daily habits. People add them to water, tea, and salads, and some even drink pure lemon juice on an empty stomach. However, this seemingly harmless ritual may be hiding a potential health hazard. A study published in the American Journal of Clinical Nutrition found that consuming more than 2,000 milligrams of vitamin C per day increases the risk of forming oxalate crystals in the kidneys by 31%. The body converts excess vitamin C into oxalic acid, which can bind with calcium and form stones in the urinary tract. Considering that one medium-sized lemon contains about 50 milligrams of vitamin C, it is easy to see how drinking lemon water, tea, and eating salads with lemon every day can quietly push a person past the safe threshold, especially if they are also taking multivitamin supplements. A real-life case illustrates this point. Bill, a 54-year-old resident of Portland, Oregon, spent 3 months following a daily routine that started with lemon water in the morning, continued with lemon juice on his lunch salad, and ended with lemon tea at night. He was not taking any medications, felt fine, and believed the lemons were helping him cleanse his body. But when he experienced sudden sharp pain in his lower back, he went to the emergency department. At Providence Health and Services, urologist Dr. Kevin Rice diagnosed him with a 5-millimeter oxalate stone in his left kidney. He required medication and a strict diet that excluded all citrus fruits. If you are concerned about your kidney health, consume lemons in moderation. For adults, a safe daily intake of vitamin C is considered to be no more than 2,000 milligrams. If you regularly drink lemon water or tea with lemon, do not add extra vitamin supplements to your diet without consulting your doctor. This is especially important for people who are already prone to developing kidney stones. A better approach would be to rotate lemons with other sources of vitamin C, such as broccoli, strawberries, or bell peppers, and to drink plenty of plain water that is not acidified. 2. Thyroid suppression due to iodine deficiency. Today, thyroid disorders have become one of the most common endocrine conditions in the United States. According to the National Institute of Diabetes and Digestive and Kidney Diseases, around 20 million Americans suffer from various thyroid-related issues. The problem is especially severe in regions where the soil and water naturally lack iodine, such as the Midwestern states of Michigan, Wisconsin, Minnesota, and Ohio. In these areas, statistics show that out of every 3 women over the age of 40 experiences symptoms of hypothyroidism, including fatigue, low energy, weight gain, and mood swings. Amid this trend, the popularity of lemon water and the daily consumption of citrus fruits has grown rapidly. However, very few people are aware that lemons contain a flavonoid called naringin. A study published in the journal Thyroid Research by scientists from the University of Pennsylvania found that naringin can suppress the activity of iodine transport proteins in thyroid cells. This is especially concerning in situations where there is a chronic iodine deficiency. With regular consumption of large amounts of citrus fruits, including lemons, the absorption of iodine from food can significantly decrease, leading to a shortage of this essential micronutrient for the thyroid gland. A real-life medical case illustrates this issue. At St. Luke's Hospital in Duluth, Minnesota, a 48-year-old woman named Alice came in complaining of constant fatigue, sensitivity to cold, and difficulty losing weight despite maintaining a healthy diet and staying active with fitness. Testing revealed low thyroid hormone levels and slight enlargement of the thyroid gland. Endocrinologist Dr. Joanne Miller took special note of Alice's habit of drinking up to 3 glasses of lemon water every day. After eliminating this routine and adding iodine-rich foods such as seaweed, eggs, and ocean fish to her diet, Alice's condition significantly improved within a month and a half. If you live in a region where iodine deficiency is common and are at risk for thyroid disorders, especially if you are a woman over the age of 40, you should avoid consuming large amounts of lemons on a regular basis. Adding 1 or 2 slices of lemon to tea or water a few times a week is considered safe. However, drinking large quantities of lemon juice every day may worsen iodine deficiency. Support your thyroid by eating foods naturally rich in iodine, such as seaweed, eggs, shrimp, and cod. And always consult with an endocrinologist before making changes to your diet, particularly if you are experiencing symptoms of hypothyroidism. 3. Bladder irritation from regular consumption of lemon juice. According to the National Institute of Diabetes and Digestive and Kidney Diseases, around 25 million people in the United States experience symptoms related to bladder dysfunction each year. Complaints such as frequent urges to urinate, discomfort, a burning sensation, and urinary incontinence are especially common among women over the age of 40. Among the factors that can worsen these conditions, diet plays a significant role, particularly the intake of acidic beverages, including those made with lemon. Although lemon water is widely promoted as a healthy way to detox, few people realize that its high citric acid content can seriously irritate the lining of the bladder. This is especially dangerous for individuals who already have a sensitive urogenital system. A study conducted at the Mayo Clinic and published in the journal Urology Health found that in women with painful bladder syndrome, consuming citrus-based drinks, including lemon water, increased the risk of flare-ups by 2.5 times. Citric acid can disrupt the pH balance of urine, intensifying irritation and creating conditions that may lead to inflammation. A real case from modern medical practice confirms these findings. A 41-year-old woman named Laura came to the urology department at Sharp Coronado Hospital in San Diego. She had decided to improve her well-being and lose weight by drinking lemon water 3 times a day. By the 5th day, she began experiencing frequent urges to urinate, a burning sensation, and dull pain in her lower abdomen. Urologist Dr. Matthew Collins conducted an examination and diagnosed her with acute, uncomplicated cystitis. During the consultation, it was determined that the only significant change in her diet was the regular consumption of lemon water. Once she stopped drinking acidic beverages and began treatment, her symptoms resolved within 4 days. If you experience discomfort related to the bladder, especially if you are prone to cystitis or have a sensitivity to acidic foods, you should avoid frequent consumption of lemon juice. Even in healthy individuals, excessive acid intake can cause irritation. A safe option is to add 1 or 2 thin slices of lemon to water no more than once a day. At the first signs of discomfort, all acidic drinks should be eliminated, and it is important to consult a urologist. Additionally, make sure to drink enough plain water without any additives to support the health of the urinary system. 4. Irritation and worsening of gastritis, increased heartburn, and acid reflux. Every year, the number of people in the United States suffering from stomach and esophageal disorders continues to rise. According to recent statistics from the National Institute of Diabetes and Digestive and Kidney Diseases, around 60 million Americans regularly experience symptoms of heartburn, acid reflux, or gastritis. At the same time, there has been a growing trend toward detox programs, many of which place lemon water at the top of the list. Ironically, complaints have been increasing precisely among those who try to cleanse their bodies using acidic beverages. Lemon is often labeled as an alkaline food, but that only applies on paper. In reality, when lemon juice enters the stomach, it actively stimulates the production of hydrochloric acid. For a healthy person, this may go unnoticed. But if the stomach lining is already weakened due to underlying gastritis, inflammation, or the use of medications that irritate the stomach, lemon can become a trigger for flare-ups. A study published in the American journal Alimentary Pharmacology and Therapeutics found that regular consumption of acidic foods, including lemons, increases the risk of developing gastroesophageal reflux disease by 38%. This risk is particularly high for those who drink lemon water on an empty stomach, add lemon juice to tea before bed, or use lemon-based salad dressings daily. One real-life example involves a 51-year-old woman named Catherine from Austin, Texas. She worked as an accountant and, inspired by a detox article in a magazine, began drinking warm lemon water every morning without missing a day. After a month, she began to experience dull stomach pain, nausea after meals, and a feeling of heaviness. An examination at Baylor Scott and White Medical Center revealed focal gastritis. Catherine had no previous history of stomach issues. Gastroenterologist Dr. Jason Holliday identified a direct connection between the irritating effects of citric acid and the inflammation of the stomach lining. Another patient, Greg, age 44, from Los Angeles, added lemon juice to his tea every evening as a relaxing ritual. After a few weeks, he began to feel a burning sensation behind his breastbone, especially when lying down. After seeking care at Cedars-Sinai Medical Center and undergoing an endoscopy, he was diagnosed with grade 2 esophagitis, inflammation of the esophageal lining caused by frequent acid reflux from the stomach. If you have ever experienced heartburn, gastritis, stomach discomfort, or even just a sensitivity to acidic foods, you should avoid drinking lemon water on an empty stomach. Do not add lemon to tea at night or before going to bed. A few drops of lemon used to season food that has already been eaten is generally safe, but lemon should not be used as a main beverage. To support digestive health, opt for neutral foods such as oatmeal, chamomile tea, or room temperature water. And if symptoms persist, it is important to consult a gastroenterologist and avoid experimenting with acidic products on your own. 5. Accelerated calcium loss from frequent lemon consumption. According to recent data from the National Institute of Arthritis and Musculoskeletal and Skin Diseases in the United States, more than 10 million Americans are affected by osteoporosis, and an additional 44 million are classified as having osteopenia, a condition that signals the early stages of bone weakening. Older women over the age of 50 are particularly vulnerable due to decreased estrogen levels and impaired calcium metabolism. However, few people realize that frequent consumption of acidic foods, especially lemons, can be one of the hidden contributors to accelerated calcium loss. Citric acid significantly affects the body's acid-base balance and the function of the kidneys. When consumed frequently in large amounts, particularly in the form of concentrated lemon juice or lemon water, taken 3 times a day, the body begins to compensate for the increased acid load by excreting calcium ions through the urine. This is especially dangerous for individuals who already have reduced bone mineral density. A study published in the Journal of Clinical Endocrinology and Metabolism by specialists from the University of North Carolina School of Medicine found that long-term and regular intake of foods high in citric acid is associated with elevated calcium levels in the urine and accelerated loss of bone mineral density, particularly in the lumbar spine and the neck of the femur. Women over the age of 60 who are deficient in vitamin D and magnesium, both of which are necessary for calcium retention in bone tissue, are especially at risk. A real-life medical case illustrates this issue. Helen, a 64-year-old retiree from New York, decided to follow a trendy citrus detox and drank 3 glasses of lemon water every day for 6 months, 1 in the morning on an empty stomach, 1 during lunch, and 1 after her evening walk. Her diet was generally balanced, but she had eliminated dairy products and did not take calcium supplements. As a result, her body quickly began to lose its mineral reserves. During a routine visit to Mount Sinai and a bone density scan, she was found to have a 7% decrease in bone density. Endocrinologist Dr. Lucas Pearson pointed to a clear link between the high acid load and the accelerated loss of calcium through the kidneys. Helen had to completely change her diet and begin taking calcium and vitamin D supplements based on medical advice. If you are over the age of 45, especially if you are a woman and are concerned about your bone health, avoid consuming large amounts of lemon juice on a daily basis. A safe amount is considered to be no more than 1 glass of water with a few drops of lemon per day. It is also essential to monitor your calcium intake. Women over the age of 50 need around 1,200 milligrams of calcium per day. This can be obtained from food sources such as broccoli, almonds, sardines, sesame seeds, and leafy greens, or, if necessary, from high-quality supplements. Maintaining sufficient levels of vitamin D is equally important as it helps the body absorb calcium, especially during the winter months when exposure to sunlight is reduced. Most importantly, do not follow trendy detox programs without a doctor's approval. 6. Potential harm to blood vessels from frequent lemon consumption in people with vascular fragility. According to recent data from the National Heart, Lung, and Blood Institute, more than 65 million people in the United States suffer from cardiovascular diseases, and nearly half of them have been diagnosed with chronic high blood pressure. Women over the age of 60 are particularly vulnerable, as the elasticity of blood vessel walls tends to decrease with age. The paradox is that this very group of people most often begins drinking lemon water as a natural remedy to improve vascular health, unaware that in some cases it may actually cause the opposite effect. Lemons do contain flavonoids such as hesperidin and diosmin, which are widely used in pharmaceuticals to support blood vessel integrity. However, dosage and individual vascular sensitivity play a crucial role. A study conducted at the Johns Hopkins University School of Medicine and published in the Journal of Vascular Health found that in patients with hypertension and varicose veins, frequent and uncontrolled consumption of lemon water can lead to overstimulation of vascular tone. This may result in localized or systemic spasms, blood pressure fluctuations, headaches, and in even temporary numbness in the limbs. In practice, this means that instead of gently strengthening the blood vessels, there can be a sharp constriction, especially in the peripheral parts of the circulatory system, such as the hands, feet, and lower legs. These spasms can cause headaches, tingling sensations, numbness, and sudden changes in blood pressure among individuals with impaired vascular regulation. A real-life case confirms this effect. Margaret, a 67-year-old resident of Santa Fe, New Mexico, began each morning with 2 glasses of warm water mixed with the juice of half a lemon. Within a week, she visited Presbyterian Santa Fe Medical Center, complaining of a throbbing headache in the back of her head and numbness in her fingers. Vascular tests revealed peripheral spasms and unstable blood pressure. Cardiologist Dr. Jonathan Reeves, after reviewing her dietary habits, concluded that the worsening of her condition was linked to the excessive intake of citric acid, which was affecting the blood vessel walls. After eliminating lemons from her diet and adjusting her nutrition, the symptoms disappeared. If you have been diagnosed with high blood pressure, varicose veins, migraines, or if you are over the age of 60, you should avoid drinking lemon water every day. Limiting it to once every 2 or 3 days is safer and more sensible. You should also avoid consuming lemon at the same time as taking vasodilating medications or supplements containing the same flavonoids. It is essential to monitor your blood pressure in the morning and evening, especially if you already have vascular issues. To support vascular health, it is better to alternate lemon with other sources of vitamin C that are gentler on the blood vessels, such as kiwi, broccoli, sea buckthorn, or rosehip tea. And most importantly, do not treat lemon as a universal remedy. If you notice any changes in your well-being, you should consult a doctor. 7. Tooth enamel damage, gum irritation, and mouth lining sensitivity from citric acid. According to the American Academy of Dental Medicine, more than 70% of adults in the United States experience issues related to increased tooth sensitivity. What many of them do not realize is that the root cause is not always sugar. It can also be acid, especially from regularly drinking lemon juice, including lemon water, particularly in the morning. Lemon juice has a pH level of about 2, which is comparable to the acidity of vinegar or stomach acid. This means that frequent consumption has a harsh effect on tooth enamel, the hard but vulnerable outer layer that protects the teeth. Enamel erosion does not happen instantly. At first, a person may begin to notice sensitivity to hot tea or cold water. Over time, small cracks form on the tooth surface, the teeth lose their shine, darken, and feel rough to the touch. This is called demineralization, and unfortunately, the process is irreversible. A study conducted at the Tulane University School of Dentistry and published in the Journal of Dental Research confirmed that regularly consuming acidic beverages with a pH lower than 4.5, especially on an empty stomach, leads to a significant loss of minerals in the outer layer of enamel within 6 months. This effect is not limited to the teeth. Lemon juice can also irritate the gums and the lining of the mouth, especially in older adults whose oral tissues are thinner and heal more slowly. One real-life case illustrates this clearly. Jennifer, a 43-year-old accountant from Chicago, drank warm water with the juice of half a lemon every morning for a year to cleanse her body. Over time, she began to feel discomfort while brushing her teeth. Cold water caused sharp pain, and her teeth darkened despite consistent oral hygiene. After an exam at the University of Illinois College of Dentistry, the dentist diagnosed her with moderate enamel erosion. Her tooth surfaces had become porous, and dentin breakdown had begun. She needed comprehensive dental treatment, including fluoride therapy and the application of protective coatings. If you want to avoid enamel erosion and painful tooth sensitivity, never drink lemon water on an empty stomach, especially in concentrated form. If you choose to consume lemon, always dilute the juice in a large amount of water and drink it through a straw to minimize contact with your teeth. Afterward, rinse your mouth with plain water, but do not brush your teeth right away. The enamel becomes softer after acid exposure, and brushing too soon can cause further damage. Make sure to get enough calcium and vitamin D in your diet to help strengthen enamel from within. And if you notice any signs of sensitivity or irritation, see a dentist before the problem gets worse. 8. The false sense of detox and appetite suppression leading to wasting in older adults. Every year, more and more detox products appear on the US market, promising miraculous body cleansing, weight loss, better health, and even longevity. One of the most popular rituals is drinking a glass of lemon water on an empty stomach. This habit is heavily promoted on social media, in blogs, and even in some fitness programs. However, statistics and real-world medical practice tell a different story. According to the National Institute on Aging, nearly 27% of Americans over the age of 65 are either underweight or at risk of undernourishment. Older adults, especially those living alone, often have a reduced appetite due to age-related changes in taste, weakened digestion, or the side effects of medication. In such cases, any further suppression of appetite can lead to loss of muscle mass, fatigue, and the development of a condition known as sarcopenia, age-related physical wasting. Surprisingly, lemons may contribute to this process. A study conducted by the Berg School of Public Health at Johns Hopkins University found that consuming acidic beverages before meals reduces the production of ghrelin, the hunger hormone, which leads to lower calorie intake during subsequent meals. While this effect might be helpful for young and active individuals, it can be dangerous for older adults. In real life, this often plays out as someone replacing breakfast or a proper snack with a glass of lemon water, believing it will cleanse the body. In reality, they are skipping meals and losing not toxins, but vital nutrients. This is especially risky for individuals who are already underweight or who suffer from chronic conditions that require a nutrient-dense diet. One example from medical practice involved a 74-year-old man named Donald, who visited Mercy Medical Center in Baltimore. Over the course of 2 months, he lost 6 kilograms without any obvious reason. His family grew concerned and insisted on a medical evaluation. During a consultation with nutritionist Dr. Towler, Andrea Slater, it was discovered that Donald drank lemon water every morning and often spoiled his appetite by using it as a meal replacement. He believed this routine was helping his liver detox. In reality, he was experiencing rapid muscle loss and his blood protein levels had dropped below normal. After reintroducing complete meals and eliminating acidic drinks on an empty stomach, his weight stabilized. If you are over 60 and want to support your health and longevity, do not rely on detox plans involving lemon water. The liver and kidneys are your body's natural filters, and they do not need lemon to function properly. What truly matters is a complete and varied diet. Consume lemon as part of meals, such as in a salad dressing or as a flavor accent in fish, but not on an empty stomach or in place of food. Monitor your weight and avoid sudden weight loss, even if it seems like a sign of cleansing. And always consult with a doctor or dietitian before making any major changes to your diet, especially in older age. 9. Negative impact on circulation, blood pressure, and sensitivity to cold. According to a report from the National Heart, Lung, and Blood Institute, 1 in 3 adults in the United States suffers from hypertension or high blood pressure. That amounts to more than 75 million people. A significant portion of them take medications to manage their blood pressure, including angiotensin-converting enzyme inhibitors, also known as ACE inhibitors. Meanwhile, lemon water, which many believe to be a harmless and even beneficial morning drink, can unexpectedly intensify the effects of these medications and negatively affect circulation. A study published in the American Journal of Therapeutics found that certain compounds found in citrus fruits, including lemons, can alter the metabolism and absorption of antihypertensive drugs in the liver. As a result, the body may react more strongly than expected. This can lead to a sharp drop in blood pressure, particularly in the morning. Symptoms may include dizziness, weakness, nausea, a sensation of the ground dropping out, and even fainting. In addition, lemon has a natural cooling effect on the body. In traditional medicine, it is considered a cooling food, a property that is also supported by scientific findings. Regular consumption of lemon water, especially during cold weather, can heighten the body's sensitivity to low temperatures in individuals with poor circulation. Women with specialdrome are experientially affected, experiencing whitening, numbness, and pain in their fingers and toes when exposed to cold. One real-life example comes from the University of Colorado Hospital in Denver. A 56-year-old accountant named Maria came in after experiencing fluctuating blood pressure. She had been taking lisinopril, an ACE inhibitor, and had started drinking lemon water every morning and throughout the day. Within a week, her blood pressure began to drop sharply in the mornings, and she developed weakness and nausea. Despite dressing warmly, she constantly felt cold, and her fingers turned pale even at temperatures around 10 degrees Celsius, 50 degrees Fahrenheit. Cardiologist Dr. Edward Lynch advised her to stop drinking lemon water and instead recommended a warm rosehip infusion. Her condition stabilized within 4 days. If you are taking blood pressure medication, especially ACE inhibitors, do not combine them with regular consumption of lemon water without consulting your doctor. Avoid drinking lemon-based beverages on an empty stomach and do not overuse them during the winter months, especially if you tend to feel cold easily or have poor circulation in your extremities. Women with Raynaud's syndrome are advised to completely avoid acidic and cooling drinks during cold weather. Instead of lemon, try warm infusions made with ginger, rosehip, or chamomile, which gently support vascular tone without interfering with medications. And always consult your doctor before making any changes to your diet, especially if you have chronic health conditions. 10. The effect of lemon water on medications, a subtle but dangerous interaction. In recent years, American pharmacologists have been paying closer attention to so-called drug interactions, situations where food or beverages unexpectedly alter the absorption or effectiveness of medications. According to the National Institute of General Medical Sciences, around 60 million Americans take at least one prescription drug every day, and more than 20 million take 3 or more. Against this backdrop, the habit of drinking lemon water may seem harmless until it interacts with certain medications. The interaction starts in the liver. The human body relies on an enzyme called CYP3A4, one of the most important enzymes for breaking down and eliminating many drugs. However, compounds found in lemons, particularly furanocoumarins, can partially block this enzyme, much like grapefruit does. As a result, medications that are supposed to be gradually metabolized and excreted begin to accumulate in the bloodstream. This can intensify side effects or lead to an overdose, even if the prescribed dose is standard. In other cases, the effect of the medication may be weakened if its activation is impaired. A study conducted by the College of Pharmacy at the University of Michigan and published in the Journal of Clinical Pharmacology found that in patients who consumed lemon water while taking statins, the concentration of the active substance in the blood increased by 1.5 to 2 times. This was especially true for lovastatin and atorvastatin. A similar effect was observed in patients taking antidepressants, anti-anxiety medications, and antibiotics whose metabolism depends directly on the CYP3A4 enzyme. A real-life example illustrates this risk. James, a 58-year-old resident of Houston, was undergoing treatment for an anxiety disorder. He had been prescribed escitalopram in a standard dose. Around the same time, he began drinking lemon water in the morning and evening, following advice from a blogger who claimed that lemon clears the brain and boosts focus. Within a week, James experienced extreme drowsiness, headaches, and delayed reactions. At a follow-up appointment at Houston Methodist Hospital, doctors found that the level of escitalopram in his blood was nearly twice the normal amount. Psychiatrist Dr. Brian Curtis explained to him that lemon was to blame. It had slowed the drug's metabolism and amplified its effect. If you take any medications, especially statins, antibiotics, antidepressants, or anti-anxiety drugs, do not consume lemon water at the same time. It is best to drink lemon water at least 2 to 3 hours before or after taking your medication, and only if your doctor approves its use. Always inform your doctor about your dietary habits, even if they seem healthy. What is harmless for one person can be risky for another who is undergoing medical treatment. Always follow personalized recommendations and never change your diet without consulting a healthcare professional. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.